Hi, my name's Fee Croucher and I'm one of the children's nurses here at the University of Bradford. I've been a children's nursing lecturer since 2013 and I've loved it. Every minute I've been here has been amazing. Before I came here, I am a children's nurse and I was working in the acute trust in Bradford since 1994. So I'm sure you can imagine I have had the privilege and pleasure to meet a huge number of babies and children and their mums and their dads and their grandmas and their granddads. And I've got to know quite a few of the babies and children over the years because some of them don't just come in once or twice. We see some of these children every month, certainly until they move on to adult services. So that's exciting in itself, that you have the opportunity to consider meeting all these families. And they all bring something different. They're individual families within their own right. The children are individuals, and that's what we respect. And that's what we love so much about nursing children and young people. So if you're successful and you do get a place here at the University of Bradford on our children's nursing course, the first 2 years will be spent with colleagues receiving the same education and theoretical content around adult, mental health and children's nursing. The Nursing and Midwifery Council have designed content that meets the needs of all three fields in the first 2 years. And that's to give you a good rounding into what it means to be a nurse, and so that you have some understanding as well, very importantly, about the other fields of nursing. Okay, your third year will be field specific. So if you're a children's nursing student, that means your third year will be all theoretical content around children's nursing and children's placements. We also have a master's course, which is a 4-year course. And if you identify and apply to do that, the third and the fourth year, 1 year will be one of the fields and the fourth year will be another of the fields. So you can apply to be a mental health and children's nurse or an adult and mental health children's nurse, okay? And the placements will reflect that in your allocation. So you will be doing placements for children on children's medical wards, children's surgical wards, children's ED, children's outpatients departments, children's respiratory specialist nurses, any of the respiratory nurse specialists. You'll be spending time with school nurses, special school nurses, health visitors. Oh my goodness, the list goes on and on. There are so many placement opportunities between Bradford and Airedale that we are confident that your experience as a student will be very broad by the time you graduate. And also, if you then choose to go on and be employed when you complete your training, the majority of our students secure a staff nurse position either at the beginning or the middle of their third year, and can move straight into employment once you have completed the course and received your Nursing and Midwifery Council registration. And that's a hugely proud moment in itself for you. Some people decide not to go straight into full-time employment, and that's fine. That's absolutely fine. That is your decision. And the luxury is you can make that decision once you know you've qualified. We very, very rarely have students that have graduated that can't find a job. So it's really positive. There are so many positions that are available to you once you qualify. And so again, we're really, really proud of that here at the University of Bradford. So during your 3 years, things I can promise you are, it is hard work, but it is so worth it. You will have help and support with whatever you're doing. That's academics like myself at the University of Bradford. And also your assessors and your supervisors on the ward, they have all been in the same position you are now, okay? So they absolutely do know what it's like to be a student, and they'll be able to support you and guide you and advise you. You can ask them questions, they'll help with your learning, they'll help with teaching, and we work together. We kind of complement each other between the university and your clinical placements. When you start in the September, On or about the middle or end of November will be when you start your first placement. So more or less from the beginning, you will be with families with proper health concerns, proper issues and concerns and worries. And so you'll be developing your theoretical knowledge in university, but essentially developing your practical skills and knowledge and competency in your placements. And you start that very soon. And that, I believe, is absolutely the only way to do it. And so you will grow into your clinical role the more placements you do and the more theoretical input you receive. I could talk forever about children's nursing, but I'm not going to. If you have any inquiries after you've looked at this webinar, please email enquiries@bradford.ac.uk. And all I want to say now is good luck with your application. Stay focused and stay true. And I shall look forward to meeting you when you join us here at the University of Bradford. See you all later, everyone. Goodbye.